Hello, everyone, and welcome to today's Legal Compliance COVID Safe webinar looking at contract tracing and QR codes. Today's session really focuses on the use of QR codes as well as some of the current laws in place covering the various COVID safe rules across the country. My name is Nihal Samara. I'm the General Counsel and Legal Director here at the law firm Kaizen Synergy. We've been running these open public webinars since the start of this pandemic back in February last year when they really started to ramp up. As part of these sessions, we will be recording this session all the way through to the question and answer part of the webinar where we actually open up the phone lines and we'll actually stop the recording there. That said, if you do have any questions throughout the session, by all means type those into the question bar as well too, and we will look to cover those throughout the session. So we will be guided by yourselves in terms of some of the core questions that you might want answered throughout the session as well too. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar, we do pay our respects to the traditional owners accordingly. So let's look at today's session and what we're actually covering off. We're going to look at obviously what the current rules are, and from week to week we see that, especially in the COVID safe space, there are legal rules that do change, and these change across the different states and territories based on really what is happening within that particular area. And we're seeing these rapidly evolve. Probably one of the biggest differences we are seeing in 2021 versus 2020 is the local government's response, whether that's state or territory governments, to quickly move to a much more ramped up lockdown phase to address what they're calling the new UK strain and to keep things much more manageable in terms of their response. But we will come back to that around what the current rules are and where to go. That said, what we are looking at today is the use of QR codes. We're going to look at how they work. We're actually going to use real life case examples, and yourselves, if you've got a mobile phone near you, you can actually, for a better word, play along or join in with us for this part of the demo and show you actually how these work, and you can participate on that. We're going to look at COVID plans and dashboards. While the focus is on QR codes, since Scott Morrison got up last year and held up the requirement that agencies have a COVID safe plan in place, many agencies have developed these, but these are still causing confusion. We've fielded questions as of even yesterday from agencies that are coming into this webinar on, well, what are the core requirements? How do these work? What else do we need to have? It's well and good to have a COVID plan in place, but what do you do? Are there forms that staff need to fill out as part of their day-to-day attendance or volunteers? If you have volunteers working in your not-for-profit agency, what else do you need to have? And we're going to cover that off as part of the dashboard as well too, that I'll walk you through. Equally, when you look at what else do you need to think about, obviously COVID safe plans and QR codes is one part, but again, policies, procedures, safe work checklists that you might need to use around doing cleaning and regular activities, COVID safe activities, what happens with those. So we're going to cover some of these key things off that yourselves need to be across as well too. As part of these legal compliance webinars, what we have also been doing, apart from just talking and showing you the law, is to actually put the law into practice. So actually showing you what some agencies have actually been doing for now almost 12 months and how they've been responding to being caught up in hotspot areas, how they've responded to new legal requirements, and also looking at some of the rules in terms of what we're talking about here, let's say QR codes, but then expanding that if you're running services, group classes, events, let's say from 1 to 5 to 10 or 10,000 people, which some agencies have done. When I say 10,000 people, it's like running fairs and Easter events that people are talking about now that we've seen. So we're going to walk through some of these areas. Obviously, the focus is on the QR codes today, but really help you join the dots backwards in terms of looking at QR codes, COVID plans, and also some of the legal compliance forms that you should be having in place, and how you can actually start using these even later today as well too. So really, by attending this webinar, COVID-19, just to put this into context, will really be with us for some time. The introduction of the vaccine, and in the news today, they're talking about when the first set of vaccines will be developed as well too. Oh, sorry, not developed, be brought into Australia. But in saying that, COVID-19 will be with us for some time. And with that, it is by attending this webinar, you should get a better understanding of the COVID rules. You'll get some QR code advice and what these do and how they work. You'll get timely collection of resources. All the materials we use today will be actually sent around to you. And we're looking at what some of the COVID safe systems and activities other not-for-profit agencies have been doing that is actually working and helping them to actually operate and grow their services during this crisis. So a few housekeeping items as well too. This webinar is being recorded up to the Q&A session, as I mentioned. You can ask questions in the chat group as well. This webinar will be published on the Gemma 360 YouTube channel, and all materials referred to will be circulated, including these slides. The knowledge base created with we do have, which includes weekly circulars as well. You can actually view that on the Kaizen Synergy Law Firm website. And if I bring that up here, yes, that's a picture of me on the front page. And under the knowledge base resources on the front page, you'll also see the past webinars and resources. And if you also search on our YouTube channel, Gemma 360, you can see that here as well too. That said, with it all, we do also have access to the dashboard, which I will talk to you about, and you can also access this directly from this particular website, which I will speak to you about shortly. So if you do have any questions, by all means, please contact us. You can do so on our 1300 number. My mobile number, which is also listed here, is also available on Google because we've been using that since the start of this pandemic, and it's been shared by thousands of companies around the country now as well. So introduction, just as a couple of slides to put this into context for you. It's just 3 slides that I will say. We have many new agencies and companies joining us today. In the last 12 months, we've supported and onboarded over 4,000 companies in the past year to help them with their COVID safe plan. And you'll get some of these resources today to actually start using as well. We will be looking and covering some of the COVID safe events if you do run those as part of your group classes. As part of our law firm, we do things a bit differently here at Kaizen Synergy. It's not just black and white law that we actually run. We actually work in the public health and legal compliance space. So introducing legal compliance and making sure that agencies keep up to date with their legislation that applies to you. And we actually have things like Bill Watch at the Commonwealth and state and territory government levels. So that way we can keep agencies like yourselves up to date with any changes in legislation as it is actually moving through Parliament. So that way, as we see things, if there's information that you need to have, rather than finding out things through the grapevine or the news or social media later on, we're actually sending you live feeds through our legal compliance system. That said, we've received a number of awards covering everything from Aboriginal, First Nation, First People awards under the NAIDOC Award in 2013, right across to presenting at the Dubai International Emergency and Disaster Conference back in 2000 around public health outbreaks in terms of compliance work as well. That said, You will get access to the Gemba 360 compliance and COVID safe platform in terms of your COVID safe planning, which I'll talk about today as well. It is also mobile friendly as well too. So idea is that especially with volunteers and staff that work at your not-for-profit agencies, if they're patching into your COVID safe dashboard or plan, you don't actually have to use it at a desktop. You can pretty much use it from any mobile device that you have as well. So let's go on, and that's all I wanted to mention about our law firm, only because we have such a large number of attendees joining us for the first time today. So let's look at contact tracing as well as using these for community-based events and real-life case studies. So when we talk of use of QR codes, let me just jump one step back. And the purpose of this is really some people are looking at using registers for either site visits. They might be using attendance registers to keep track of who is actually attending sites that you might have, or it even might be at clients' sites that you might be visiting as well too. You might be running group classes as well, or community events too. Either way, attendance registers need to be kept by your agency, and this has been for the last quite some time in 2020 of attendance registers and what you need to have. And then usually that includes things like first name, phone number, and time that the person actually came in. A couple of the case examples to jump straight into those that we will be talking and using today is firstly Rumballara Aboriginal Cooperative, and we acknowledge Laurie Seville, the Chief Operating Officer out there, who actually has given us permission to talk about some of the works that Rumballara Aboriginal Cooperative actually does. They're a very large service. I'm saying of the 200 to 300 mark, diverse services from justice programs, elders, aged care services, medical services, chronic disease services, right out to homeless and support services as well too, as well as drug and alcohol services. We also have Women's Housing Limited, and I acknowledge Judy Line, the Chief Executive Officer out there, and also Lena Tompkinson, the Executive Assistant and Compliance Officer at Women's Housing. And we will also be mentioning Lindy Parker, the Chief Operating Officer at Women's Housing Limited. They are a women's housing and support services, but also provide housing to both male and female clients. With that, they actually, and we'll actually use their QR code system to show how that works in the sandbox that we have to show how it works. Now, part of that was that they actually run multiple sites, and from their base at Cremorne in Victoria, they needed the ability to see who's coming in, what time they're coming in, when and how long they're spending there and the likes, and have the ability to actually monitor their contact tracing requirements themselves. Keep in mind that both of these agencies, uniquely, if we look back over the last 12 months, have at one time or more, at least Rumballara, at least on 2 occasions, and Women's Housing, because of the different sites that they run, have actually been involved in a number of hotspots. And not the full agency in Women's Housing part, but some of the sites at which they have client services from have actually had to deal with hotspot areas. And we'll be walking you through this as well. So let's have a look at the QR codes and the check-in workflows of how this works. And if you've got your mobile phone, I urge you to grab those and you can participate in this. I will add, if you'd like to use a private name when you do scan your QR code, you can, but just keep in mind that any information you use will also be just visible to other attendees today. So if you wanted to use a fake name for this, you certainly can when the QR code gets scanned on your phone as well. And I'll show you what this looks like before you do it. So essentially the QR codes, why do we do it? What's the functionality? Let's look at the contact tracing and alerts to agency and the speed and usability. So these are the 4 requirements that we generally talk about with agencies when they want to talk through and set up QR codes. The first reason is really around why to do it. The reason that you need to do it is from public health and work health and safety requirements. It is required that you keep your contact registers in place, and also attendance registers too. From a work health and safety point of view, if WorkSafe comes and audits you and says, can I see your audit logs, or if there's an outbreak as well too, you need to be able to give the department access to it if you're running your own QR code system as part of this. And I'll talk through that a bit more. Equally, from a functionality point of view, it's got to be easy to use. It's very difficult as it is dealing with people of different, I'm going to say, IT skill levels. And it needs to be something that is fast and simple for people to use. Also, from a contact tracing and alerts point of view, again, if you needed to, if there was not just during an outbreak, but also if you wanted to verify who is actually using it, are all your staff actually being compliant, or volunteers being compliant in actually completing these forms, then you need to be able to view this data set. It's like, and I've said this to other agencies, from a legal point of view and work health and safety compliance point of view, what's the point of having a QR code if you can't actually see your own data? It's simply like leaving a piece of paper register on the front desk and then basically not seeing who's actually completed it. So you need to be able to see your data of what's there. So let's see how this works. So essentially what I'm talking about is, at the moment, you may well actually have something similar to the top row, where you might have an event and workplace register. This was something that Creation Ministries International has been using. And I acknowledge Sonia out there at the Creation Ministries International, who actually has set this up for their services right around the country. Now, let's have a look at how this QR code works. Essentially, what it does is gives you a barcode type picture, and you're able to scan this in on your mobile device. Once you do that, it essentially then opens out into your dashboard. Now, what I am going to do is actually bring up my own mobile phone to show you how this works, and I'll actually share this on the screen with you. So essentially, here we go. We're going to just bring my phone up for you as well too, and we're going to place it right over the top of the device that's here on the picture of the screen. Here it is here. And yes, you can see my kids on the screen from my mobile device. You can also see I've had 41 missed calls today as well too. That's been rediverted, and also a couple of text messages. Here we go. So with it, if I bring these up, here is my phone. I'm going to take, you can quite simply go to using the photo icon. So how I do that is simply click on the camera button. All I'm going to do is lift this up to the QR code screen picture. You can see it comes up, and what comes up is a link that now I click on at the top of my screen. This is a test site. You can see I've got test form right in the middle here. I'm just making the screen bigger for you. And this will go into our test site for you. Now, quite simply, what we do is this. It asks a series of questions. So let's see how this works from a legal point of view, okay? So first item I'm going to put in, and I'll put in my real name here, Nihal Samara. You can do this with me as well too, keeping in mind that any data you submit will appear on our register. And this is just a test register. So you can use your own name, or if you don't want to, for privacy reasons, you can create another name altogether and enter in a dummy phone number if you like. So here we are here for testing purposes. So I'm going to add in my mobile number that's also on the screen. Now, what we have from here is two things to look at. Firstly, we have your, if we go up, who your agency name is, what the purpose of this form is for them to fill out, what the person's name is, phone number of details, and then what we've done, if you look at here, is actually bring all the COVID symptoms questions together. And there are there's 10 questions that we have here, everything from, do you have the following? fever, shortness of breath, cough, sore throat, increased tiredness, etc. And we've seen a lot of these questions before, and this will appear on the information I send out to you. So with it, what we have with this is to answer yes or no to one or all of these questions. Now, what I'm talking about here is that if you answer yes to this, to one of these questions, then essentially you're answering yes to all of the questions. And that's what we've done specifically to make it as simple and as easy as possible for people to view. Now, what we can do here is simply click no. Now, in this case, it's reason for visiting the property, or you could actually use it for reason for visiting a group class, a site. So we can actually, and you can actually change these words around, but essentially it's the same thing. So I'm going to say reason for visiting property, and I'm in this case going to go, and I'm going to just put in test here because this is what it is, but I'm going to put it's a group class that I am attending. Is there any comments? No, around that. So what I can then do from here is simply click submit, and that sends that information out for me. Now I'm simply going to close that down for now and stop sharing my screen with you. But what I am now going to do is actually bring up the dashboard. Now we've just had a question from Naomi, and it's a really important question, which is why we will address this here. Naomi's just raised, thanks for sharing this information. You touched on accessibility. We work with people who are blind or vision impaired. How would you suggest the best way for undertaking this process is for people who are blind? That's a really good question, Naomi, with that. With it, what we do have is voice activated questions to actually guide people through this as well too. And that is an application that does run on this system as well too. One of the areas that we also cover across a number of our clients is people who are blind or vision impaired, or also have disability services, and I'll say even broader, people from non-English speaking backgrounds as well too. So what I'm showing you is part of the system that has the workflow. If there are specific areas that we need to extend each of those, then we can certainly work with you to actually do that. And that might include things like actually having voice activated devices to assist people as well too, answering questions, or even other, I know, technology devices that people might have to support them in completing these types of forms. So that way, from a public health response, you're able to meet those requirements and support them as well too. Good question. So sorry, I've just got another question coming in that I will just drag on as well too. And this was from Laurie, who just asked, what if you answer yes because you are short of breath? That's a really good question, Laurie. So what we have, if we'll just bring up the form again, and I'll just go back to the form to scan this form because it's a really good question. Thank you, Laurie, for asking that. What you will find on the form, and I'll just make this bigger down the bottom, if you answer yes, so let's do that. But what I'm going to do here is actually put in, and we've got this section for any comments. So saying, I have shortness of breath because of my asthma, okay? And it'll auto asthma. There we go. It'll auto correct it. So this way, if there was any other questions that you wanted to, any other points that you wanted to add in, that's why we've actually put in that specific comment section. But it's a really good point, Laurie, around that. Now, let's talk about what happens once you fill in this form. Where does it go? What happens? Right now, what we want to be able to do from here is actually have a look at some of the data sets that we can see from here. And how we do that and where we go with this is quite straightforward. So what Women's Housing Limited have done is use the Gemba 360 COVID safe dashboard that you can see in front of you, and you will actually get access to this dashboard today. So you can see a button here down the bottom, and I'll just make the screen slightly bigger for you to be able to see. And I'll cover some of these other modules out for your COVID plans and COVID forms as well too shortly. But you can see we've got a COVID safe contact tracing button right here on the bottom left-hand corner near the notice board. Now, where we go from that is once you click on that button, what in fact comes up is this screen here. And you can actually have a look at all the different 13 responses that we've got. And so from here, we can see we've already got 13 responses from the number of people that are jumping in today as well too. And we can actually look at all of the information of who's sent what and when. Equally, no one said yes as well too around this, but we can see who's done what and actually drill down into every single one of these forms. And if I wanted to actually have a look at individual forms, I can do that as well too, and actually view who is actually typed this information out. Now, importantly around this, one of the things we also have is the date and the time of who's actually seen and when these have actually been registered. So importantly, you can actually contact trace and run your information and registers directly from seeing this information here on the dashboard. Now, Steve has just asked, in Queensland, I understand the only questions allowable to be asked are name, contact number, email, or residential address, time in and time out. With that, Steve, we're looking at also this from not only a public health response, but also work health and safety requirements as well too, and from a legal compliance area on what information do you have or do you need to ask around this in order to meet your work health and safety obligations. And this is similar to what you have even in your if you look at the attendance register at the top of the screen, it actually covers, and I'll just bring this back up again, back to my slides, here we are here, the attendance registers at the top of your screen. So again, there are parts of this that you actually need to have information on. Now, we've just covered off how this works. Equally, what people have done is use these QR codes and actually created their own information that they've placed on their front doors or side entrances, and also use this on other policy documents or the likes. And you can see this here. What we have set up for you, and this is just a Word document of an example of one, and again, it's the same QR code that we've actually set up. So with it, you've actually got access to this information as well too, and I'll show you where to find that on your dashboard that you will get access to. So with it, what we have seen around this, and this is the demo site for women's housing, but what I will show you is essentially on your Gemba 360 dashboard, you will get your login details. If you don't have those already, you can go to our website and click login. It'll bring up a big blue button. It'll ask you for your login details, which we'll send you today. And essentially what you've then got is access to the disaster module in the middle of the screen. Once you click on that, you'll bring up this page here, and you can go into your project screen, and under the COVID safe plan, step 1, step 2, step 3, which is what Scott Morrison was talking about, we've actually loaded those in as templates, and you've got what we call the documents section here. And this gives you a complete list of the legal compliance documents you need for your agency. Now, first one, let's just jump into this, is around the QR codes, because that's why you're all here today. So under this panel here, I can actually have a look at the QR code document. And if I click on this one here, you can see it here, it's listed here, and essentially open it up. And here's my QR code. Each of the QR codes is actually different for each agency, obviously. This is just our test one, and again, it's loaded in there for you to use. What we do also have in here is also the QR code template form as well too, which is an example of this one here for yourselves to use as well, and you can replace that with your own letterhead and information as well. So it gives you that information. Now we've just been asked a question from Fred. What about other things like the WorkSafe checklist for cleaning? Where do we find that information and the likes? Well, what we've done is you can see it here, safe work cleaning checklist. We've got that document here. It's the guidelines of what you've got, and you can click on that and you've got that at your resource. Keep in mind it is used by other agencies, so if and when cleaning staff comes through, they get generally people to complete this form, tick it off, and they then upload it back onto this dashboard, which you can then keep all your information on. Also, what you do have is the other physical distancing requirements, and also Commonwealth directions, so specifically around what employers need to do and when. And this is an example of one of those. This was published by the Commonwealth and still remains true. There are about 14 different items that you need to have across your COVID safe plan, and this covers all of these through it. Just on this, I can see a few questions coming through of how do you actually manage each of these items? And that's a good question. So what we have done on here, if I go back, is looking at, and we're just jumping ahead a bit, but I'm happy to do this because of questions coming through, is we've got your directions from the Commonwealth. And if you're based on where you are, for example, Steve's based in Queensland, if you're based in other states as well too, we've actually loaded in not only the Commonwealth roadmap, but each of the state and territory roadmaps, depending on where your agency is based. From there, what you do have in here is your COVID safe plan directives. And each of these step 1, step 2, and step 3s, if I go back, so let's have a look. Under projects, I go to open from here, and I've got step 1, step 2, step 3, as well as other activities we need to follow. Now, if I open each of these, what these gives me is assessment, for example, individual tasks. So assessment of sites, setting up my QR codes, doing my workstation checklist, ensuring all staff complete a COVID assessment, and I'll come to what that looks like, as well as reviewing policies. So effectively, we've broken down every single step that you need to do as part of your COVID safe plan. You can then use this to then keep a detailed worksheet of all the activities that you've done. And you can see we've updated these here. So every time somebody does something or there's a WorkSafe audit that's going on, a footprint is left behind, and you're able to keep this as your COVID safe plan. Now, we've just had a question from, I can see who it is, Betty, who's just asked around this, how do I actually extract this report if I need to send this to the state health department or the likes? Well, quite simply, you can do this. On the right-hand corner, there's a little PDF document, which I've just clicked here. We're doing this in live time, and here it is here. So essentially, I've got my COVID plan that I can then basically save and email out to the relevant health department, and it's that quick. So we've had a couple of agencies, one being the Migrant Resource Centre down in Victoria, who has had to submit a COVID safe plan, and their policy and risk officer out there had literally, I'm going to say 24 hours notice to get something back to the health department. Well, all they needed to do was in literally 5 minutes after completing it is load it up, here it is, print it out, and literally send that out, and they're done. So they're able to run literally live reports across this whole system in terms of their COVID safe planning. Now let's get back to the QR codes and also the legal requirements for yourselves to follow. So once you do this, one of the issues and challenges that agencies have had was essentially, and we've set this up here, is around some of the department QR code systems. And when we've set this up, some of the problems that some agencies have faced is once you, and we've just put a smiley face down here because it's a live form, is that once you actually take a photo of this and then try and load it, in terms of how the Victorian one works, you need to download the app, You then need to complete it, then take another photo of it, and the information that you actually have, you don't actually see. So some of the questions that agencies have actually raised is, what do we actually do? So essentially we're handing over our entire attendance register. We don't actually know whether our staff are actually doing it or not. We don't know if our clients are doing it. And if we needed to get information, we can't actually rapidly get that back from the department for us to see. So to their credit, the departments have actually sent this out, especially the one in Victoria, and just marked out that if you are using QR code services like the ones we are helping, you may be asked to hand this across. And with that, Rumballara Aboriginal Cooperative up in Shepparton, when they were part of two hotspots that were located in their nearby neighbourhood. Essentially, they were able to open it up when the department required them to do so and actually show information dating back right through to February last year. And they've actually held on to their information. Now, I can see a number of questions coming through around this. And before we jump into the new rules, people asking about how long do we actually need to keep QR code or attendance register information. Currently, the department's suggesting, I believe 30 days is the current notice period. However, we're looking at this from a work health and safety point of view, which actually may span a lot more than that period. So if people are needing to register, while that might be under a public health response, a lot of agencies are actually holding on to information a lot longer, especially around safe work practices as well too, and also to ensure that they meet their legal compliance obligations. So let's have a look at the new legal compliance rules that your agency needs to follow. When I talk of the COVID safe steps, step 1, step 2, step 3 as part of your plan, this is something that Prime Minister Scott Morrison launched last year. And we can see this as part of the 3-step framework. What we have done for agencies is to set up and look at the legal compliance structure so that that way you can actually keep up to date and also ramp up when you need to. So some of these was around the biosecurity legislation, looking at directives that came out of the Commonwealth, as well as the safe work checklist, as well as the pandemic checklist, and give people the tools that they need around this. And also identify where you can improve it before things become an issue. And essentially, this gets fed back into your COVID safe plan. This also includes industry plans where you need it. And when you look at how to manage your QR codes, you can start to see that this is just one part of your entire compliance work that actually needs to go on. So essentially what you'll find on your dashboard around this, and we've got a scaling cost for agencies depending on the size and location. We are opening this up to all agencies joining us today for you as well. So in response to Graham's question in terms of the cost of the fantastic dashboard facility, it is a sliding cost for you to use as well too, and depends on number of staff and the likes that you have. But essentially, it is being open for yourselves to access, and we have done this right across the board for some 2,000 plus, 4,000 plus agencies in the last 12 months. Now, with this, one of the things that we need to look at is how to respond to the various lockdown rules, and we're going to explain those coming through. There are a range of restrictions currently being rolled back, rolled up right across Queensland, and some of the questions that people frequently ask have been summarised in these next slides. I'm not going to go through every single point around this, but essentially what we have done is ask people questions around some of the commonly and frequently asked questions that you wanted us to address prior to the webinar, and actually summarize these down into these slides. So that includes how many people can I have over at my house? When do I actually need to wear a mask across the different states and territories? How many people can actually gather outside. And we're going to send all of these materials to you today to actually look at. And also, when do you need to start to use your different COVID-19 checklists and also have different COVID safe event protocols in place? And this actually varies from state to state. Equally, looking at when can someone visit an aged care facility, and also looking at various conditions across restaurants, cafes, or pubs. We are aware that a lot of not-for-profit agencies will actually utilize restaurants, cafes, and pubs as part of their meeting places, and also for use for group classes as well. So with that, we've included that as part of these slides. And also now, with all the different restrictions on travel and holidays within states, we've included those for you to have reference to as well too. There has been a question just coming back from Steve in relation to, can we ask staff or require staff to not to travel during work times? Steve, this comes back to what involvement they have within your agency. With it, if there is a rule to be able to work from home, then you can provide that to them. If your question is whether you can actually restrict travel during times where there are restrictions in place, then yes, you can, unless it's and only if there are exemptions provided by the state. So that is something just to watch in relation to what states and territories actually say. That said, how we actually look at these when you think about running events and setting up QR codes, there are really 6 things that we tend to look at. And this is something consistent that we've used over the last 6 months. First thing is, let's look at your relevant state or territory laws. Does it allow us to run events, community gatherings, group classes, etc.? So even before setting up your QR codes, let's look at what we're actually talking about. Most of us today are talking about whether we can actually use QR codes as part of returning to the workplace as well. The second part is, does the venue have a COVID safe plan? If you're leasing a site, or do you need to actually develop your own COVID safe plan? From there, what services am I running? Is it remote services, virtual services, where staff are providing, let's say, support to people with mental or health, other health services, or are clients actually required to come onto the site? That will actually change what you need to have in place for that particular site. The fourth one is, can I maintain the rules of work, health and safety and venue capacity? And this comes back to looking at your safe work requirements and the dashboard in terms of social distancing and cleaning. What else do you need to consider? Well, what are the policies that you need to have in place, as well as then the register of attendees? And that's when you start to use your QR codes and checklists for your agency. So what's there to actually think about? Well, there are a number of areas that you need to look at. One is around your safe work guidelines, and we've covered off the different checklists that I'm just flicking through today. Also around registers as well. And this is something, as I mentioned, that Sonia and I acknowledge Creation Ministries International, Sonia Evans at Creation Ministries International is using. With it, what you can see here is the event and workplace register. And what they've got is quite a simple one. And when I say simple, not simple is in easy, it's easy to use, not simple as in basic or anything like that. So what they've got is the date, first name, phone number, check-in, check-out, relationship, and areas visited. And to go back to Steve's question around questions, well, if you need to have some of this information at hand in order to be able to do your own contact tracing, but also, Steve, to make sure that you meet your workplace health and safety obligations. So things like, if there was different areas within a site that people visited, well, then you may need to undertake further cleaning of those areas and regular cleaning of those areas. You're not going to have that information if you only are covering name, contact number, and email address or residential address, and that's it. So there are further information that you may need to capture as part of that. Now, joining the dots is one of the important parts around this that we can see. So as I've mentioned, the QR codes, the dashboard, being able to use a mobile device. I pick up on actually Naomi's question in particular around people that are blind or vision impaired. That is important to look at well, who is actually using this system as well too? Who may come in that actually may need additional supports in order for you to protect and deliver appropriate services to your clients. So it is important, and I thank Naomi for raising that important question. As I've mentioned, joining the dots is around this can be used from the dashboard, Rumballara Aboriginal Cooperative, and I will just bounce back to this agency in terms of what they've done. What they've got, and we've shared some of the, they've got policies, they've used staff training on the dashboard, and you'll find that you've got access to the e-learning space around this. They've got pandemic forms, which I will talk about now as well too, as well as HR registers. So when we talk of the COVID safe plan section around this, when we jump into the dashboard, and I'll bring it up here that you'll have access to, you've got your COVID safe plan that you can see here. What you've got also sitting through this is a list of policy documents. So we've actually taken all of the policy areas that you need to look at, and this is just our test site here. And if I look at policies, then you've got the COVID-19 policies that you can see here, and we've actually set up the templates for yourselves to use as well, and those are accessible there, and these are live systems as well. Now, one of the other things that has come up a lot, and I can see people asking questions around this, is how do we actually screen staff? What do we actually need to do in order to ensure that our staff and volunteers are kept safe? Is it enough to do a QR code? Well, it depends on how you've set up your QR code of what you have. What a lot of agencies have done is use what we call a COVID-19 daily assessment form, and you'll find that on your dashboard. When you click on that button, what comes up is this form here. It asks you, and this is just an example of one, and it asks you a series of questions. So what are the, do you have shortness of breath, increased tiredness, body aches, etc.? All the questions that we had in the QR code, but it also more importantly asks these questions up here. Have you visited any outbreak locations since you last showed up to work? Now, agencies like Rumballara will actually ask these questions of all of their staff on a daily basis, because with that, anyone showing up to work, they're a health and wellbeing service, and also provide services to vulnerable communities. They're an Aboriginal cooperative service, but they also provide services to people who are elderly, in the aged care services, and other people identified as vulnerable members of the community. So with that, they've got to ask these questions. And with that, what you'll find is that, for example, they're based in Victoria, but equally your forms will have your relevant state and territory listing here. And if we click on that, what we'll find is it actually automatically links to the department's site. And so people can get real-time checks on whether they've actually visited any of the sites. And we've just seen a few sites that have come up this morning at, let's say, 9:30 a.m. that's been lodged. So with it, essentially live checking is done, as well as the date and the time that it's been registered. So you can see we've got this all on the one system for yourselves to use. And going back to this, Rumballara have actually kept this going back since the start of the pandemic, dating right back to February. And they've got some, I think, over 16,000 individual contact point tracing records to be able to go back on. And that's important from a safe work and work health and safety legal compliance point of view, not just from a public health point of view. Equally, policies are also located there as well too. We've got a list of the 9 specific policies. Some of these are used now as templates by a number of agencies as well. The other one that we've just mentioned, and as I finish this off and open the phone lines for questions, is women's housing. And again, doing exactly the same thing, different size agency, but again, they've got their QR codes in place. They've got their different workstation forms that staff fill out. The cleaners have their safe work forms as well too, and these get poured back into their COVID safe plan as well. You do have access, or you will get access to your COVID safe dashboard as well too, along with all the materials we're talking about today. We do have some recommendations and take-home messages for all of you. One is around reviewing your QR code policy. We've got templates of those which you'll receive today. Create a task and measure if you've got your COVID safe plans in place, the QR codes should be able to fit into that. Have a look at the identified workflows that we've spoken about. You can see that these meet your legal compliance obligations. They're already being used by agencies. So what we're actually showing you is not just a summary of the current legislation. We're actually showing you what is actually working out there and what other agencies that have actually been involved in a number of hotspot regions have actually done and how they've responded to it, and equally how they've come out of the other side unscathed and been able to support staff during this pandemic. And it's actually a really important item to take home around this, where agencies like Women's Housing, through Lena Tompkinson, Judy Line, and Lindy Parker, I do acknowledge the three people there that have guided the agency using QR codes, using their legal workflows to actually ensure that all of their staff have actually been kept safe during this pandemic. The same thing for Rumballara Aboriginal Cooperative. Throughout this pandemic to date, they've actually been able to actually help staff, all 300 staff, and ensure that they've met all of their legal compliance obligations, and again, kept all of their staff safe. And I think that's a real kudos to Laurie Seville out there, the Chief Operating Officer, and the entire executive management team equally, when you're talking of those numbers and involved in substantial hotspot regions where they're located on the New South Wales-Victoria border as well. If you do have any questions, by all means, contact our law firm. My mobile is available on Google, and our 1300 number is located here. By all means, please contact us if you do have any questions. We will stop the recording and open up the phone lines, and more than happy to stay on the line and answer any questions that people might have. If you are listening to this recording on our YouTube channel or through another medium, by all means, please contact us on 1300 360 360, or you can email us if you require support for your agency. Thank you, everyone, for joining us today, and see you next time.